What's up, guy? In this lecture, we are going to discuss the arterial and the venous supply of the thyroid. Before discussing these supply, we have to discuss the different parts of the thyroid. So let's get started. First of all, before discussing the different parts of the thyroid gland, we have to discuss the different components that are related to the thyroid. First is the larynx, which is also known as the voice box, that is present above the thyroid gland. And at the center you will see the trachea, that is the windpipe, and above the windpipe you will see the presence of the thyroid gland. Now this gland having three parts. First is the right lobe, second is the left lobe, and third at the center, this region is called the isthmus. Isthmus is a region that connects the right lobe with the left lobe. So this is the three components of your thyroid gland. Now, first we will see the arterial supply of thyroid gland. So first artery is the superior thyroid artery that supplies the blood to the upper part of your thyroid. Now, superior thyroid artery actually originate from the external carotid artery. The origin of this superior thyroid artery is the external carotid artery, and it will supply the upper part of your thyroid. That is the first artery related to the thyroid. Second is the inferior thyroid artery. Now this artery will supplies the blood to the lower part of your thyroid gland. This inferior thyroid artery having origin from the thyrocervical trunk. So this is the second artery that will supply blood to the thyroid gland. And third, that is variable. It is present in some person, while some person haven't. This thyroid artery, it will supply the blood to the isthmus. This artery will not be present in every person. So that is important thing about the thyroid artery that will supply blood to the isthmus. So these are the three most important artery. Two must be present in everybody, while this artery can be present or cannot be present. So it will be a variable artery. So next is the venous drainage. So you will see the three most important veins that are present in everyone. First is the superior thyroid that will drain blood from the upper part of your thyroid, and it will drain blood into the internal jugular vein. That is important thing. Second, middle thyroid vein, it will drain blood from the middle part of your thyroid and drain into the internal jugular vein. And third is the inferior thyroid. It will drain blood from the lower part of your thyroid, and it will drain the blood into the brachiocephalic vein. So these are the three important veins that carry blood away from your thyroid gland. And last, most important thing that you have to remember, superior thyroid artery is close to the external laryngeal nerve. That is another important thing regarding the artery and the nerve. So external laryngeal nerve is close to the superior thyroid artery, while the inferior thyroid artery is close to the recurrent laryngeal nerve. That is the important thing. So in this lecture, what we have learned today is the three arterial supply. Two must be present in everyone, while one can be vary. While you on the other side, we have discussed three venous supply related to the thyroid. So this is all about the blood supply to the thyroid. If you still have any question, you may ask in the comment section. Thank you so much.